As we all know, the NASD is the non-pneumatic anti-shock garment, as you can see in the picture. Just to run through, it's a low-cost, reusable, easy-to-apply first aid device in obstetric hemorrhage. During delays, it provides stability for transport up to 48 hours. People have kept it on for even 3 to 4 days. Made of neoprene and Velcro. It's also popularly called as the life wrap. Sir has already mentioned the principle that by compression it stops the bleeding and it shunts blood to the vital organs, thus acting as anti-shock. Going back to the innovation, NASD has a long history. In the 1900s, the first inflatable pressure suit was developed. In the 1970s, the NASA was involved in developing it into a non-pneumatic version. This was originally used in hemophiliac children during episodes of bleeding. Its use for obstetric hemorrhage in the low-resource settings began in 2002 by Dr. Carroll and Dr. Paul Hensley. It has been widely used, and a lot of studies have been done in Nigeria and India. As you all know, in the public health sector in Tamil Nadu, it is widely used, and thanks to BSOG, a lot of us have been sensitized to the NASD in Karnataka too. And now, over to Dr. Sunita and Dr. Smitha for a live demo of the NASD. As you can see in the picture above, various segments of the NASD. There are about 6 segments of the NASD. This is segment 1, which encircles around the ankles. Could the video person please focus on to the NASD? Next, we have the segment 2, which encircles around the calf. Then we have segment 3, which encircles around the thigh. The next 2 segments, segment 4 is the pelvic segment. Segment 5 and segment 6 are noted, and these are the abdominal segments. Now coming to the placement of the NASD. As I already mentioned, the segment 1 needs to be placed over the ankles. Now we have Preeti as our volunteer. Yeah, she is a patient, who has collapsed. So in such a patient who has collapsed, you need 2 volunteers to wrap the NASD. But if the patient is conscious, even 1 volunteer is sufficient. So here we have both the volunteers, and they'll have to move the patient to one side so that the NASD can be brought below. What needs to be noticed is the Velcro on the 5 and the 6 strips has to be folded inwards so that it doesn't stick to the bed or the patient. So now the NASD is in place. How do you ensure that the NASD is in the correct place? You have to check by placing segment number 5. As you can see, the segment number 5 has a ball. It has a foam ball to cause pressure application over the uterus. Now this segment number 5 has to be at the level of the umbilicus. If this is ensured, you know that the placement of NASD is going to be correct. Now we start wrapping the NASD. And the other things that need to be ensured is that the upper border of the NASD should be at the level of the lowest rib, and over the NASD there are dots, there are yellow dots, so that the patient's spine has to lie over the dots. Now let's start wrapping the NASD. One thing you need to remember, wrapping is fast, removing is extremely slow. So we start with segment number 1. Now since there are 2 volunteers, they can simultaneously wrap the segment number 1 on either side. So we start with segment number 1. Pull tightly with all your strength and wrap it tight. The purpose is compression. How do you ensure that the NASD is tight enough? As Dr. Sunita is demonstrating, pull onto the segment. You can hear the snap. Yeah, so that says the segment is tight enough. Next, move on to segment number 2. The 2 volunteers do it simultaneously. Wrap segment number 2 over the calf. Next, segment number 3 over the thighs. Tight enough to cause compression. So we have made sure that the patient's knee is free. Could you please flex the knee and show? Yeah. So that is helpful when we want to put the patient into either lithotomy position or when she wants to use a bedpan. All right. Then next we come to the pelvic segment, that is segment number 4. From now on, it is only one volunteer who has to do this. The segment number 4, 5 and 6 has to be done by a single volunteer. So there, she's wrapping segment number 4.
Just above the pubic bone.
Over the pubic bone. Okay. Next, segment number 5. The ball is placed over the umbilicus. And segment number 6 is wrapped onto it. Now, the NASG is in place, providing effective compression. What are the things that can be done with the NASG in situ? The uterus is atonic, you want to provide massage. Lift segment number 4 and 5, place your hand over the abdomen and compression can be given. Suppose you want to do a vaginal exploration, it can be easily done. With the NASG in situ, the patient can be put into the lithotomy position by folding the legs abducted, and vaginal exploration can be done for any bleeding, especially traumatic PPH. Want to proceed with an abdominal procedure as an exploratory laparotomy? Yes, that too can be done. The only things that need to be taken care of is the entire OT team should be completely ready, everything should be in place, and segment number 4, segment number 5 and 6 need to be opened just before putting the incision. The anesthetist needs to be alerted. Once the segments are opened, the BP is going to fall, the heart rate is going to increase, so they need to be alert to take care of this. Post-surgery, immediately rewrap segment number 4, 5 and 6. By placing a bedpan, by lifting the segment number 4, the patient can urinate and defecate with the NASG in situ. Alright, now the NASG has worked, the patient has stabilized. When do we think we should remove the NASG? NASG removal has to be done under strict medical supervision. So we have Dr. Sunita checking the vitals of the patient. All we need to check is the pulse rate and the blood pressure. For 2 hours, if the pulse rate and the blood pressure is stable, just hold on. For 2 hours, if the blood pressure and the pulse rate is stable, we can consider removal of the NASG. The rule of 100 needs to be remembered. If the pulse rate is less than 100 and the systolic blood pressure is more than 100 millimeters of mercury, and another number 50, that is if the bleeding is less than 50 ml per hour in the last hour, we can consider removal. Removal starts with segment number 1. Segment number 1 is removed. Please wait. Wait for 15 minutes patiently, monitoring the vitals of the patient. At the end of 15 minutes, if the pulse rate has not increased by 20 beats per minute, or if the blood pressure has not dropped by 20 millimeters of mercury, it is safe to remove the next segment. Go ahead and remove segment number 2. Again, wait for 15 minutes, vital stable, remove segment number 3. And similarly, every 15 minutes, proceed to the next segment till the whole NASG is removed. At any stage, after removal of any particular segment, if the BP drops, as I said, by 20 millimeters of mercury, or the pulse rate increases by 20 beats per minute, immediately rewrap the segment and go back to rewrap all the segments and check the source of bleeding again. So this was the demonstration. We still have a couple of things about the NASG. Washing. As we all said, low resource settings, it is extremely useful. In countries like Nigeria, it has been used about 50 to 60 times. So it is important for us to keep it in a good condition. So how do we go ahead doing the washing? First, pick up the NASG, wear thick rubber gloves, and wash it under running water to remove whatever debris is present. Following which, very simple, sodium hypochlorite solution or bleach solution is what is required to clean the NASG. 0.01% solution, so generally about 40 ml of bleaching powder in 30 liters of water in a bucket. Submerge the NASG in the bucket for about 10 minutes. And maybe you can keep a heavy weight over it like a stone so that it gets completely submerged. This is enough to disinfect the NASG. Make sure that, and then it can be washed in running water. Make sure it is not put into a dryer. Instead, it is hung with a rope, from a rope or from a wall. It is just hung to dry. Now this NASG has been processed, everything is ready. We need to repack it and keep it readily available for next use. So how do we fold back the NASG? as she's already shown, segment number 1, 2, and 3, which are there, have to be folded upwards onto the segment number 5 and 6. So it is completely folded back, and bring it up to segment number 5 and 6. Fold back segment number 4. Yeah, bring it back and then close it. Your NASD is ready again for subsequent use. I hope that was informative for all of you. Thank you very much.